We formulated Arginetix for one purpose alone, is to improve the cardiovascular status of our patients. But who can take Arginetix? It is from the very young to the very old, from the healthy to the ones with cardiovascular disease, such as hypertension, diabetes, stroke, heart attack, congestive heart failure. Our studies have confirmed that healthy individuals who take Arginetix improve their cardiovascular status, and it's been shown in the way we have done our test to look at how their cardiac performance improves with and without Arginetix. We took a series of patients and gave them Arginetix and we tested them as to the distance and the duration of the exercise, as opposed to when they did not take Arginetix. There was a clear improvement in their performance by about 20%. Blood pressure. Patients who take Arginetix, we noticed that their blood pressure dropped by about 30%. So much so that patients who were taking blood pressure medications, when they started on Arginetix, we needed to titrate down on their blood pressure medication. Diabetes. Arginetix was shown in our study to decrease hemoglobin A1C, which is a marker for blood sugar control. It dropped by about 10% in patients who are taking Arginetix, simply because patients who take Arginetix improve their exercise capacity, improve their exercise performance. At the same time, Arginetix improved vascular flow in the pancreatic bag. Therefore, more insulin became available, and therefore the diabetes, the blood sugar, dropped accordingly. Bone metabolism. Patients who take Arginetix have vitamin D in their system. Therefore, it improves bone structure. We have measured their bone density pre and post Arginetix, and has clearly shown to actually decrease the rate of decline of bone dissolution, at the same time improve their bone density score. Eye function. Currently, we are undertaking a study with cooperating with ophthalmologists to look at the use of Arginetix in decreasing or at least improving in patients who have developed macular degeneration. Because Arginetix improves microvascular flow, we hope in the near future to demonstrate that it improves macular degeneration as well. Athletes. We have clearly demonstrated in athletes, world-class athletes who run marathons and sprints and who play professional sports such as basketball and football, taking Arginetix improve their performance. We measured their lactic acid accumulation pre and post exercise, as well as on the subjects who would exercise with and without Arginetix. There was a 23% improvement in exercise tolerance and performance. At the same time, the rate of rise of lactic acid during exercise and Arginetix was much slower, and the washout post-exercise was much faster. Therefore, directly relates to performance improvement and recovery improvement. 5. Cardiovascular flow. We looked at patients with ischemic cardiomyopathy, on patients who are taking Arginetix. We looked at their cardiovascular flow using nuclear imaging technology to look at how well the circulation improved in patients who had microvascular problems, small vessel disease. During and after Arginetix infusion, cardiovascular flow in the cardiac bed improved, showing a definite improvement in circulation in the myocardium. Therefore, it improves cardiac function by improving blood flow in the microvascular circulation.